Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our Facebook Lives. As we move through this pandemic, we've been with you every Tuesday night now for over a year, and at other times as necessary. So please join us every Tuesday night from 6 to 7. In addition, we have a daily press release Monday, Wednesday, and Friday, and then a TV spot through the week at KMTR. I'm going to be on the radio next week at 8:30 in the morning. So trying to get as much information out to you as possible. Again, if you have questions, this is a chance to get your questions answered. We already have a number of very nice questions submitted to us at Facebook questions at douglaspublichealthnetwork.org. So if you have those, please send them to us. In addition, you can put them in the chat section and we'll get to them now. So let's, as we have done since the beginning of time, start at the beginning of the world and look to see what's going on. Well, in the world, we're clearly having another rise in the number of cases. So depending on how you count it, this is the fifth peak, and it's the fifth peak, which is a definite increase over the last month or so. And it's a worrisome increase in the world because it's pretty widely spread. We're still seeing a lot of cases in South America, although that's quieting down, but we're now seeing cases in the Caribbean, with the British Virgin Islands having the highest case count in the world, case count per 100,000 in the world. Cuba is also there. Africa, which I've been terribly worried about for months now, is now heating up more. There are now 11 countries in Africa that have significant activity, and so that's a real worry. And those go from the north in Morocco, Libya, Senegal, South Africa, Zimbabwe, so lots of places in Africa. And given the fact that they have very low vaccination rates and not a very good healthcare system, I'm afraid it could really blow up. And the UK, highly vaccinated, locked down until this week, still having over 60 cases per 100,000 per day. That is an enormous number of cases. You know, at the worst, we were 20 or 30 per 100,000 per day. They are at over 60, which is worrisome. And then we're seeing a little bit more cases in places that have not had a lot of disease in the past, such as Indonesia, Malaysia, and Thailand. Japan is having some cases, and when you watch the Olympics, they're going to be very different Olympics. Now again, Japan overall has a very low number of cases. So the total number of cases in Japan in the whole country is only 3,000 for a country about a third our size. So still a lower rate of cases than the U.S. has. So they have 2.5 cases per 100,000 per day, whereas the U.S. is 11. So they have a fourth as many cases, and they are very worried about bringing in all these cases in from around the world, and especially because of the Delta variant, which is now the most widely spreading variant everywhere in the world. The U.S. is overall heating up again. So while we had a really quiet time for a couple of weeks, it's now really starting to heat up again. Again, we're averaging in the U.S. about 11 cases per 100,000 per day. But it's very varied, because when you look, for example, at New England and New York, they're having a very low number of cases. So there is not a single county in Pennsylvania, New York, and New England that has a rate that's higher than Douglas County. So all of those counties, the thousands of counties in that area, hundreds of counties in that area, there are none of those areas that have a higher rate than we do. And that is good luck, but it's also, I think, in large measure to the fact that they also have very high vaccination rates. When you look in the U.S., still a lot of disease in Missouri, Arkansas. We're starting to see disease in southeast Wyoming. Starting to see a bunch of disease in the Tulsa, Oklahoma area. And then Florida, especially northern Florida, is really heating up. So there's a lot of places to worry about in the U.S. Oregon is overall pretty quiet, but a lot more than we've seen in the last few days. 700 or so cases yesterday, over 500 cases today. When you look in Oregon, Medford, Jackson County, Josephine County, Douglas County, Lynn County, all starting to heat up a little bit. None red hot yet, but we could get there because of the variants, and we'll get to the variants in a bit. And so Douglas County, we're averaging about 11 cases per day. That's more than we should see. And far more hospitalizations. We like 12 in the hospital today. Some people as young in their 20s, people to their 90s, but overall we're seeing sicker, younger people. The other thing we're seeing is overwhelmingly the people who are getting sick are unvaccinated. So pulled the data today, we had 85 cases in the last week. Only two of the 85 were vaccinated. Only 2 of the 85 were vaccinated for a vaccine efficiency of 97%. So the vaccine really works. And the people who've gotten the vaccine, when they get sick, get mildly ill, none have been hospitalized in the last few weeks. So again, the vaccine is out there and the vaccine works. And maybe the reason we're seeing a very low rate of disease in New York, Vermont, New Hampshire, New England, is that they have really high vaccination rates, 70-80%, where we're considerably lower, depending on how you look at it, between in the 40s or 50s. So it really is a worry, I think, with what's happening, because I'm afraid that what we're going to see is a real bump in the number of cases. Okay, let's get to the questions that we have here, and we'll see what we've got. So Paul says, so it looks like we're averaging a little over 10 cases per day. I think that's correct, at 10 or 11. I imagine most, if not all, of those are not vaccinated. So again, 83 of 85 were unvaccinated. Only 2 of the 85 were vaccinated. Is there more in a particular age group testing positive? How many children under 12 have been impacted? So about 11% of our cases are 18 and under, and that's about evenly distributed between kids who are 0 to 12 and then 12 to 18. So they're not making up the majority of the cases, but we're seeing lots of cases among kids as young as just a year old. The age range of those hospitalized as of this afternoon, we have people as young as 29 and as old as 95. But again, we've seen more and more hospitalizations of people in their 30s and 40s. Some of these people are pretty sick. When you need to be in the ICU, you're sick. You know, you need to be pretty sick to get into the hospital in the first place, and then to get in the ICU, you need to be quite sick. So that really is worrisome. Paulo also asks, has the Delta variant arrived in Douglas County, or will we still have that wave crashing on the unvaccinated? Well, as it begin to arrive, so we had our first reported case 2 weeks ago, we got the report last week of somebody, group that traveled to the Arkansas area where there's a lot of disease, came back and had COVID, and now a bunch of those people have it. We don't know and don't think there's been any further spread, but we think it's really just a matter of time until the Delta variant takes over. In every place we've seen that gets Delta variant introduced, within a relatively short time, Delta becomes the dominant variant, and that is a big case. So it seems that there are a lot of staff cases at long-term care centers in June, according to the OHA report. What are your thoughts on that? Well, that is a tragedy. So we have a bunch of long-term care centers where many of the staff have gotten infected. Now, when you have people at long-term care centers, they're the residents, they pretty much stay where they're at. They're not traveling a lot or bringing in a lot of disease, but you have staff, mostly young, many poorly paid, who may have other jobs, may live in communal settings, who have lives. They're 25 and 30-year-olds who go to parties and bars and whatever else, and then they get sick and they bring it into these facilities. The thing that's tragic is the low rate of vaccination among the staff. Now, you think if you worked in a nursing home, everybody said, you've got to get vaccinated, I have to protect these people. Yet the rate of vaccination of people working in nursing homes is far less than 60%. In fact, there was one big outbreak in Eugene where only 36% of the people were vaccinated. And we have long-term care facilities in Douglas County where the rate of vaccination is in that 30% range. So that's what's happening. So staff is there, they're working together indoors, relatively close settings, and then they get the disease. The other thing is that these seniors, the vaccine works pretty well for them, but it doesn't work nearly as well in people in 90s as it does in people in their 30s. And so you might start to see some breakthrough cases, and indeed, that's what we've seen. So Charlie says, are there any more drive-through events planned where I can get the J&J vaccine? Tonight, right now, go over to Music on the Half Shell, they have it, and they'll get it for you. They're going to be every Tuesday night at Music on the Half Shell. We're going to be at the fairgrounds, all places where you can just go and get the vaccine. So how safe is it for someone who's fully vaccinated to go to the gym? And what precautions should I be taking? Well, so you can't see, but I just came back from the gym. And so the precautions I take is I tend to stay my distance from people. So when I worked out today, I didn't get within 10 feet of anybody. If I was really close to someone, I might wear a mask, but I did not because in this case I was 10 feet apart. And so I think spacing is important. If you can't space, to use a mask. But the most important thing is to get the vaccine. So with the case counts staying like they've been for the last couple of months and vaccination numbers flattening out and variants showing up, is it fair to say that COVID will be a big part of our community for the next 12, 24, 36 months? I can't predict the future. So even the present is hard to predict, but the future is much harder to predict. But I think you're right. I think what we're likely to see is we're likely to see ups and downs in the number of cases as new variants wash through. If I could guarantee that the variants we will have, are the variants we have now, I'm not worried about that because the vaccine is very effective against the variants we have now. What I'm concerned about is that it starts with the Delta, gets a few more mutations, and now is either spreads more quickly, is more serious, or is more resistant to the vaccine, or a combination of those, in which case we're in real trouble. And that's why I want to get as many people vaccinated and the case counts as low as we can get them now so that we don't have to do that. But unfortunately, I think looking at all that disease in Africa, looking at all that disease in the Caribbean, looking at all that disease in South America, it is undoubtedly we are not done with this in the next few weeks or months. So looking about the vaccine effectiveness, again, we've had 2 of our 85 cases are breakthroughs. The vaccine 97% effective. Now, I will tell you, breakthrough cases get a lot more press than other cases. So there was somebody on Pelosi's staff and somebody at the White House who were fully vaccinated and became positive, and there was a lot of story about that. There were a couple of guys who worked for the Yankees who were vaccinated and got the disease. And so that will happen. If 100% of the people were vaccinated, you'd still have an occasional disease, and they'd all be breakthrough cases. But again, a vaccine efficiency of 97% is just amazing. So with places with high rates of vaccinations having a high number of cases, how do we have confidence in the efficacy of the vaccine and justify taking the risk to give it to our kids? Gabrielle asks. And that's a good question. Well, in the places that do have high levels of vaccination in the U.S., using the vaccines that are available in the U.S., they have very low number of cases. If you look at Vermont, New Hampshire, New York, Connecticut, Rhode Island, they have almost no cases of disease because they have it. The places that have high vaccination rates and a high number of cases have had unusual vaccination patterns. So in Mongolia, that's had a relatively high, they've used a lot of the Chinese vaccine. I don't think the Chinese vaccine works very well. Bahrain, which has had a very high level of cases, also used a lot of the Chinese vaccine, which doesn't seem to work very well. So the Chinese vaccine is a bit worrisome, and that's not surprising given the kind, given the kind of vaccine it is, right? It's an inactivated vaccine. So an inactivated vaccine only has as much spike protein as you give inactivated particles, whereas the mRNA vaccines give you the directions on how to make spike protein. And so you would expect a much better response from the mRNA vaccines, and you get it. The UK has a lot of disease, but they've not given much of the vaccine to young people who seem to be the ones who are mostly spreading it now. Justify given the risk of giving to our kids, people can see this in different ways. So the UK just came out today with a suggestion that they're not going to press for vaccine for kids because their risk is lower. And so you could have that argument. I think that it's still totally in favor of giving vaccine to kids, but there are some well-meaning people who've looked at the data and interpret it differently. So if you take me, so I'm 65, my risk of the disease is very high. If I got it, there's maybe a 5% chance of dying. And the risk for the vaccine for me are relatively low with the mRNA or the vaccines, either Pfizer or Moderna. My risk of getting a side effect is really quite low. So my benefit from the vaccine is high and the risk is low. And thus, in my case, it's 1,000-fold better to get the vaccine than it is to get the vaccine, than it is to get the disease. Now, if you are if you're 18 years old, your chance of dying from the disease is relatively low. Right? We've not had any deaths in Douglas County of people in their teens or 20s. And the risk of the vaccine is a little less well known because we haven't given it to millions. But the military did. So the military gave 2.8 million doses of the mRNA vaccines. And the only significant side effects they saw were 23 cases of relatively mild myocarditis. So they know that when the people got the disease, the sailors got the disease on the Teddy Roosevelt, which is an aircraft carrier in the Pacific, that there were a bunch of people really quite sick. So even in the military population, probably the youngest and healthiest population, I think it really, I think it still makes sense to get the vaccine. But there are well-meaning people, including some people in this community, who don't think you should give it to teens. And I think that's going to be a continued debate. Now, I think as we get more data about the effects and the side effects, that may change. But right now, I think there is some controversy in giving the vaccine to kids under 18. So Kat says, is the UK's high rate of cases from high levels of testing, or is their hospital rate up too? It probably is a combination of both. They're doing a great job with testing, so they're probably finding a high number of cases, and their hospital rate is up, and their death rate is up. So it may be a combination of that. The other thing that they're seeing is much of their disease, because people 40 and above, almost everybody 40 and above has been vaccinated in the UK, and so they're not seeing many cases in the older people, but they are seeing cases in younger people, especially those who have not been vaccinated. So a study on J&J came out saying it's not effective against the Delta variant. Will you need a booster? So this is a concern, because our two breakthroughs, the two people who got the disease had gotten the J&J vaccine. And so, again, the J&J vaccine you would think would be less effective than the mRNA vaccines because just a single dose, and it's a viral vector vaccine, which is probably not as strong as the mRNAs. So you need a booster. I think we're going to learn a lot more this week about whether you're going to need a booster after the J&J vaccine or the Pfizer vaccine and how we're going to do it. Right now, there's so much talk and so little light on this that I don't know the answer. It would certainly not surprise me if they said that if you got a J&J a month or more afterwards, you should get a booster of an mRNA vaccine. That would make great sense, I think, but still not yet approved. But we'll know soon. So Laura says, how long after wrist surgery should a person wait to get the vaccine? No need to wait at all. So as soon as you're able to come home after the wrist surgery, go get the vaccine. So there's no minimum or maximum time to wait. So Roxy says, how safe is the vaccine for people who have autoimmune disease? The vaccine seems to be perfectly safe for people with autoimmune disease. In fact, there are no special side effects that people get. Now, people with immune disease, and there are lots of different kinds of immune diseases, may not make as good antibody levels. And either because of the disease itself or because of the medicines used to treat it. And so there is talk about, for people with autoimmune disease or other immune diseases, or people with weakened immune systems, that they might need a booster to boost it. But again, this is still not yet well determined. So I think for people with autoimmune disease, definitely get it. You might need to get a booster, but we don't know that yet. So Corey said, do you think masks are going to be required in schools this fall? So I got 300 emails this weekend from people, really 300, about telling me about, masks in school are terrible, the worst thing ever. And the most effective thing in school would be to vaccinate everybody who is eligible to get a vaccine. Because when we saw the disease get into schools, it mostly got into schools from unvaccinated staff. So unvaccinated staff got the disease wherever they would get it and bring it to school and then spread it to others. So the most important would be to get vaccine for the staff. I don't think you can require a vaccine for the staff. Do I think masks are going to be required? Well, the current strategy, and we're going to learn more about it this week, the current strategy is it's up to the local school boards. Public health recommends the use of masks in school, but I do not know. A good study in North Carolina that looked and said that if you're using masks in school, it really dropped the number of cases. And so there is some recommendation for masks. But it's a little confusing because the CDC says if you're vaccinated, you need to wear a mask in school. Other people say you do. So again, it's changing science, I think, and thus changing recommendations. What do I think if you ask Bob? I don't really know. I think the most important thing would be get as many people as vaccinated as possible. Again, really, if all the high school students and the teachers were vaccinated, we wouldn't have to worry much about the high school. And although the kids do get the disease, they're usually not getting it from other kids at school. They're usually getting it from their parents at home. So I don't know what we're going to do about masks in the fall, but I will let you know as I learn. Okay, so is the immunity that you get from having COVID around the same protection or different from the vaccine? Courtney asks, that's a great question. And so there are places in the world that looked at this. So Denmark looked at the entire experience in their state, and they found that overall, having had the disease gave you about 80% protection. A little less than the 95% you get from the mRNA vaccines, but still pretty good. It seemed to last about the same as long as the vaccines, which is at least 6 or 9 months. We don't know if longer. However, older people 65 and above, I don't feel older, but older people 65 and above only had about 50% protection. So for young, healthy people who had it, it's not quite as good as the vaccine. For older people, it's much less good than the vaccine. And so that's the recommendation, that if you have the disease, that you should at least get the vaccine. And I would agree with that. So has Douglas County had anyone hospitalized from the vaccine? Any vaccine deaths? So we have not had anybody hospitalized. There were 2 people who died after they got the vaccine. These were people who were in nursing homes who were expected to die at some point anyway, for other underlying disease that put them in the nursing home. Those cases were carefully reviewed, and the thought was that their deaths were not from the COVID, but from the other underlying condition. So how many deaths have we had from the COVID vaccines in the U.S.? Complicated question. So the story is there are some, right? There are some related to the clotting issues that we saw with the J&J vaccine. Don't know. There might have been some from the anaphylaxis with the Moderna and the Pfizer vaccine. There have been 600,000 deaths from the disease itself. Now, there's a very careful system called the VAERS system, the Vaccine Adverse Event Reporting System, so that if you give anybody a vaccine and they have any kind of reaction over the next 6 weeks, you report it, whether or not it's due to the disease or not. So, somebody can get the vaccine and then later have a heart attack. Somebody could get a vaccine, later have a brain tumor. And all those things get reported, whether they're actually from the vaccine or not, then gets investigated. As best I can tell, we've not had any of those. Now, some people have looked and said, you see, all these people got the vaccine and then they died. Well, you gave a lot of these vaccines to people in nursing homes. People in nursing homes die. And so the question is, did they die at the rate you would have otherwise expected 92-year-olds to die, or did they die at an increased rate? And they've carefully looked at that, and there does not seem to be an increased death rate among those who've got the vaccines. So some places that do the rapid test don't seem to want to do the PCR. How can we get tested for the variants, Courtney asks. So the way we test for variants is what you need to do is you have two ways to do it. One is you can do a viral culture. Very, very few places do it in viral culture. The other way to do it is to do a PCR test. The PCR test multiplies out that sample. If that sample has a fair amount of virus in it, then what you can do is you can do the sequencing. Some of the troubles with getting this is that the rapid tests don't tell you about the variants, and the PCRs can't tell you about the variants if they have a low viral load. The problem is the viral load peaks on the third, fourth, fifth, sixth day of the illness and then goes down. So many times people don't get tested until the fifth or sixth day. They get tested with a rapid test by the time we learn about it and send the test to the state there on the sixth or seventh day, and their viral load is now too low to go ahead and test for viral sequences. So if you want to get tested for the variants, the way I would do it would be if you had a positive rapid test, I would immediately get a confirmatory PCR sent to the state lab. So not wait 2 or 3 days. As soon as you had the positive, get a confirmatory that you would send to the state lab, and the state lab then would do the viral sequencing, and that would be the best way to do it, and that's what we are recommending. So should those of us who have had both doses of the vaccine still be cautious about going out to the store? And again, you remember, I have never said something is either totally unsafe or totally safe. Being vaccinated increases your level of safety by 20-fold. Going in the store when it's not crowded increases it more. Wearing a mask increases it more. Staying distant from people increases your safety more. So all those things you can do to make it safer are great. Again, the number one thing that makes far and away the most difference is the vaccine. Masks are okay. They're not nearly as effective as the vaccine. Distancing is pretty good, not nearly as effective as the vaccine. First thing is get vaccinated, and then once you're vaccinated, you're overall safer, but then still distancing, avoiding crowds, avoiding unvaccinated people are good things to do. So someone says, if we're fully vaccinated, should we still wear a mask? And the answer would be there's no recommendations that you need to. So neither the CDC nor the state recommends that. Some places are doing that. So Los Angeles County, I see today, is requiring the use of masks. We are requiring the use of masks in certain settings, like in doctors' offices and in mass transit. And the story is, should we wear a mask? Yeah, if you want to wear a mask, wear a mask. I don't have mine on right now, but I wear my mask around my neck all day, and if I go to a place where it's going to be crowded or with people I don't know, I just put it on, and I think that would be the safest thing to do. The one thing we have to do is that if people want to wear a mask, we shouldn't berate them. If people don't want to wear a mask, we shouldn't berate them. Really, what people should do what makes them feel safe and comfortable, and wearing a mask can add to safety. Now, there are people who say, I don't need to wear a seatbelt in the car because I have airbags. Well, wearing a seatbelt and airbags is safer than either one alone, and so we would recommend it. But would I drive in a car that doesn't have airbags? And yes, I do sometimes because I need to do it. I know it's not quite as safe as my new car with airbags, yet it's one of those relatively small risks that you take. Now, if I was not fully vaccinated, would I go to a crowded concert or bar? I wouldn't. However, on that continuum of risk, there are clearly people who do. I mean, if you've watched the ball games, the NBA games, there are a lot of people packed into those arenas screaming and yelling, and if there's somebody there who's positive, they could easily spread it to others. Okay, we have a couple of other things. One is we talked about the UK, and again, when the UK looked at it, they are not yet moving forward with vaccinations for teens. I think that's a difference in the way they looked at it. Again, their point was, let's get all the older people vaccinated first. The problem in our country is that we've not done that, right? We've not vaccinated the older most of the older people, right? So if you look at people in their 50s, still a minority of people in their 50s who are fully vaccinated in Douglas County. So if you don't want to vaccinate your kids, that's fine, but then you should get vaccinated, because again, that's how we stop this disease, by getting more and more people who are immune. Well, last time there was a question about the numbers, about how many people have been vaccinated. So I pulled the numbers from all of the different sources today. And so let me go through those numbers with you. This is going to be a little confusing, but so the problem with the vaccine status is people have used the word vaccinated to mean so many different things. So you have to be cautious about what you mean when you say vaccinated. Does it mean 1 dose of vaccine? Does it mean 2 doses of vaccine? Does it mean 2 doses of vaccine plus two weeks, which would be really truly fully vaccinated? And then you look at the denominators, the whole population, those 18 and above, those 16 and above, those 12 and above, those currently eligible for vaccine, which is same as 12 and above, or the total population. So here's the numbers. You want to write them down. So we have 52,794 Douglas County residents, 16 and above, having received 1 dose of vaccine. And that number comes from a combination of the state data and the federal data, and includes our best guess, which you think is very close, of doses given at the VA, at the tribe, and doses that Oregonians received in other states. 52,794. The OHA shows that 43,615 have received 1 dose of vaccine. But their numbers do not include the VA, tribal, other state data, and almost certainly is an undercount. The CDC has 50,155 having received 1 dose. That's pretty close to that original 52,794. And likely reflects the number of VA doses that do not get attributed to a specific county. So Oregon attributes vaccine to a county by looking at your address, doing a GPS lookup, and telling you what county it's in. So you put my address in there, and it says it's at this GPS address. That GPS address is in Douglas County, and it gets it there. The feds don't do it that way. The feds say, what county are you in? Sometimes people don't know, right? They're traveling nurses or whatever, and someone says, oh, I live in Yoncalla, and the person doesn't know whether Yoncalla is in Oregon or not. So they put county either not applicable, which it is applicable, or unknown. And so there's a bunch of unknown, and I think that's the difference here. So the numbers that are numbers and the CDC numbers, very close. But that means that only about 55.6% of adults 16 and above have gotten 1 dose of vaccine. That number really should be 75 or 80%. So to have it at 55% is really low, and suggests we have a lot of adults out there who are at risk of getting the disease. And again, think of these numbers here. So we're talking about 50,000 people vaccinated. We've had about 4,000 cases of the disease. To get us up to that 75%, we need about another 15 or 20,000 people vaccinated. If we're adding the number of people immune by the disease, 10 or 20 every day, it's going to take a year to get to that 75 or 80. That's why we need these people to get vaccinated rather than say, I'll just wait and take my chances with the disease. The other thing that we saw looking at this, the CDC reports completion rate. That is, people got the first dose of Pfizer, Moderna. Did you get the second dose? We're 97.7%, and that's one of the highest counties in the entire country. So we're doing a good job of getting the second dose to people who got the first dose. However, our numbers of first doses are still pretty low, and the number that we have here of 52,794 is probably spot on. We're probably not missing anyone with that. So the reason our numbers are low are not any kind of data issue. It's that many people in Douglas County have not yet gotten a disease. But I would recommend go get it. Not gotten a vaccine. Go get a vaccine. We're going to have them at the Music on the Half Show. We're going to have them at the fair. we're going to have them around where you can get your vaccine. And again, the vaccine in the last week, 97% effective in Douglas County. Pretty darn great. Now, when you look at that, we don't test asymptomatic people. We're not doing a lot of screening. So the number could be a little higher or a little lower than that. But that number is right in the range of what we saw in all the other studies. And so really strongly recommend that people go ahead and get their vaccine. Okay, let's see what other questions we got here. All right. So, one of the questions come up was what's going to happen at the Douglas County Fair. So Douglas County Fair is going to happen this year. Some of the details are still being worked out, but there should be pretty close to what it was in the past. What would be my recommendation for going to the fair? I wouldn't want to do any inside rides, and I think they're not going to have any indoor kind of rides. Rides on the outside, pretty safe because of all the air movement that goes on. The buildings at the fairgrounds, pretty safe. They have these big doors that are open, lots of airflow through those. But again, I think it's the close quarters that you'd worry about. So after the concerts, when there's 1,000 people lined up to go pee or tinkle, as Giannis would say, you do need to be careful. Okay, let's see what else we got here. Okay, why do workers in nursing homes have to wear masks? Because most of the residents are vaccinated. Is it theater or putting on a good show? Well, there's a lot of stuff we've done during this that I think has been theater. I think spraying down ceilings and whatever else, probably didn't need to do that. Trucks on the outside spraying things down, probably don't need to do that. But workers in nursing homes, we do worry about them. We think masks protect you a little bit, mostly protect others. And again, many of the workers in nursing homes are younger people, may have other jobs, may live in congregate settings. And as we said before, in some places only a third of them are vaccinated. So they pose an incredible risk to the residents should they get the vaccine, go to a bar, come to work, and spreading it to others. So that's it. So someone says Canada is opening up the border soon. Will they accept the J&J 1 dose? I do not know yet. So different countries accept different vaccines or not. The J&J vaccine is pretty much only done in the U.S., so we don't know. I will try and look that up tomorrow, but I can tell you, stuff like that is really hard to find. So what is our vaccination rate in Douglas County now? So again, the thing that I'm looking at is people 16 and above who received 1 dose of vaccine. That's a number that other people, so 16 and above, and you received at least 1 dose of vaccine, 55.6%. Again, it should be over 70 or over 80, but it's 55.6% as of this morning. So our family and friends are all vaccinated, but they have a 9-year-old who's not. Would you go to the Music on the Half Shell with them? Absolutely. So Music on the Half Shell, outdoors, lots of breeze. The risk of getting this outdoors, very low. I would have no problems going to an outdoor activity with a 9-year-old who's not vaccinated. So with kids under 12 getting sick with any virus so easily, when should parents consider having them tested for COVID? So the problem with COVID is in the first day or two, there's no very particular symptom of COVID except for the loss of sense of smell or taste, but only about 1/3 of the people have that. So about 2/3 of the people, when they have COVID, for the first few days, sort of seem like they either have a cold or a sore throat. Allergies is the big one that we hear, or that's just bronchitis or something. And so I think if your kids are sick, they should get tested for COVID, right? So we do, at the clinic, we're doing COVID tests all the time because people call and they say, my kid was sick and they had a runny nose and a fever and a cough. And the good news is 95% of the time it's negative, which is what you want to expect, right? You're not hoping that everyone's going to be positive. If every COVID test you do is positive, you're not nearly doing enough tests, right? The positivity rate, which is something we follow, we like to have less than 5%, meaning that 95% of the tests you do are negative. That's what we want to see. So I think if there's any question, have them tested. The test for COVID is so simple. It's a swab in the front part of the nose. It's not that deep, go down your throat kind of thing like we had before. It's just right there. And so if any questions about your kids being sick, just get them tested. And then the good news, we can give you the good news. The good news is it's negative. However, we had a couple positives in the last week or so you still need to pay attention. So Les says, is Pfizer still on target for 5 to 11-year-olds for the vaccine in September? I do not think so. I saw something from somebody who's fairly knowledgeable. That's probably not going to happen until the first of the calendar year. So I think that's it. So I don't think we're going to have vaccine for 5 to 11-year-olds. And the argument about not vaccinating teenagers, and again, stating this, that there are some well-meaning people who are a little worried about giving vaccines to those 12 to 18, although I think the data is totally in favor of giving to them. That argument is going to be even stronger for 5 to 11, because at 5 to 11, the risks are even lower. So is our hospital rate still twice the state rate? Yeah, our hospital rate is high. We have about 4% of the population, and we have 12 people in the hospital, which is a relatively high rate. And why is it a high rate? Well, some of it is that we have an older population. Older people tend to get hospitalized more often, and we have a low vaccination rate. With a low vaccination rate and more elderly people, we're going to have a higher hospitalization rate. So the hospitalization rate is high. And again, people may have this sort of gauzy view about hospitals from the 50s or 60s where you'd get admitted to the hospital for a week for a workup or for exhaustion or whatever. That's not the way modern hospitals work. If you can be treated as an outpatient with home oxygen, home monitoring, home anything, they don't admit you to the hospital. So to have this number of people in the hospital, and especially this number of people in the ICU, is just scary. So when I look today, without trying not to give anything in particular, so looking at our hospitalizations today, and we look at these every day, and so here are the Mercy hospitalizations. So two people born in the 80s, that means they're in their 30s, are in the ICU. You have to be really sick to get into the ICU. A person born in the 90s in the ICU, and then a person in the 70s. So, people born in the 70s, 80s, and 90s in the ICU. I mean, that's shocking to have that many relatively young people who are there. In fact, when I look, there's only 3 people in the ICU. There are 4 people of the 12 who are there today who are older than me. All the others are younger than me. And so this disease is, a 38-year-old says, I'm healthy, I don't need any damn vaccine, I don't need anything, I'm going to be fine. And the answer is, you're not fine if you wind up in the ICU. So there are a lot of people in the ICU. Okay, let's see if we have any more questions here. We may actually call it a night. Okay, how many positive cases are from half vaccinated people? So of the 85 in this last week, 2 were from people who had gotten gotten 1 dose of the J&J, so they were fully vaccinated. I think 2 were in people who got 1 dose from Moderna or Pfizer, and the other 81 were in people who got no doses. So again, 1 dose of vaccine gives some protection. 2 doses of vaccine gives great protection. And again, but the overwhelming numbers of people are people who have not gotten any vaccine. And that's disappointing, because we do have the vaccine out there, and the vaccine is safe and effective, and I'd recommend you get it. But again, we are not going to push people. We are not going to go ahead and browbeat people. We're not going to be coming to your door and telling you must get the vaccine. Now, we would love to come to your community, because we know there are people who live in relatively far away places like Tiller or Camas, for whom coming to Roseburg to get a vaccine may not convenient. So we'd like to go out to these places to offer the vaccine, but we are not in any way going to browbeat people to do it, or to knock on your door and tell you it's time for you to get vaccinated. Our goal is to make it easy for you to get vaccinated and to be happy when you do so. And that's where we're going to be. All right, so it looks like this is it for the night, which is great. Again, as always, be safe and be kind. If you do have questions, send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll do this again next Tuesday night. Thank you.